Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We'll be speaking with Dr. Ron Silverman, Senior Vice President, Global Medical and Clinical Affairs, and Chief Medical Officer at 3M. He's joining us to discuss how the company's AI and automation technology has helped healthcare providers increase efficiency and focus more on patient care. Welcome to Health Professional Radio, Dr. Ron Silverman. Thank you so much for joining us.
Thank you, Neil, for having me. Look forward to speaking.
Well, Senior Vice President, Global Medical and Clinical Affairs, and Chief Medical Officer at 3M. You've got your hands full. Tell us a bit about your position and a bit about yourself.
Sure. So I'm a plastic surgeon by training, and I was a full-time plastic surgeon for 10 years. And then my research led me to work ultimately in medical device companies. And now I'm at 3M leading their clinical and medical departments. And it's a wonderful opportunity to touch many lives around the globe.
How prevalent is burnout, clinical burnout in the medical profession?
So clinical burnout has been growing over the years, and I think the pandemic really just accentuated it and pushed forward this process. A lot of it has to do with the administrative burden on physicians. And, you know, the turnover of nursing staff and other clinical staff, a lot of that burden falls on the physicians. Electronic medical records has been very positive in many ways, in many obvious ways, you know, transferring of records from one hospital to another or one physician to another. But it has interfered with the patient-doctor communication. And caused a lot more administrative burden, you know, placed on the physicians themselves. I just recently had my annual physical with my primary care doctor, and he sat on the other side of a computer. And, you know, it just takes away a little bit from that, you know, typing away, you know, as I am, he's, you know, looking at the computer screen while I'm speaking. So that adds time, and then, you know, you get called from the billing office that something's incomplete, and so this is a big contributor to physician dissatisfaction and burnout.
Is part of this burnout knowing that your patient is aware of this lack of attention, this appearance of the lack of, empathy, as opposed to the importance placed on this administrative process? And that causes a rift, I would think, in the trust, the comfort level of the physician-patient relationship.
Absolutely. It sort of interferes with that relationship. And then there's also just the stress of knowing that you have to complete all of this computer work either while you're with the patient and certainly at the end of the day, and then to, you know, for days to follow. So it's a lot. And so the 3M M-modal portion of our Health Information Systems division really has been working and already has today solutions to improve this physician burnout, improving efficiency, saving time. One of the great offerings today from 3M M-modal is our Fluency Direct program, which is a cloud-based AI-powered program using natural language understanding. So with a smartphone, a physician can stand there and record, you know, essentially dictate into the phone, either while they're with the patient or in between patients, and then this using, you know, just normal conversation. And then this can create clinical notes that the physician can then go back in and edit. And that, you know, that's certainly, if you can do that, you don't have to sit there typing on the computer. There's a great advantage to that. And so that's a current offering, which is, you know, available. And I think that it's a fantastic way to improve that patient-doctor interaction.
Is there a way that this technology can improve the efficiency of the staff that used to support the physician? It would seem, you know, you said you had a high turnaround in nursing staff and support staff. They're experiencing burnout too for the same reasons. Why has this burden been put on the physician? I mean, everybody was burned out during the pandemic, but it seems that this was coming long before the pandemic. This, replacement of staff with the physician taking
Yeah,
over their
absolutely.
duties?
Budgets have been tight. It used to be that, physicians might always have a medical assistant or a scribe that would go in and sort of like take notes and type things for the physician. That is not readily available to everybody, and the turnover rate for those roles has increased. And departments that used to have scribes or physician's assistants to do that sort of work often do not have that currently. As hospital budgets are tighter, and also just the turnover requires there's a lot of lost time in training people. And one of the great functions you talk about support staff. When you're dictating a note or typing a note in, if you forget something that's important for the billing, and as physicians, it's like the last thing you want to think about is billing when you're trying to take care of a patient. I mean, you certainly don't want your doctor thinking about charging and billing while you're coming in with a certain with a stomach ache or whatever it may be. And so if the physician doesn't describe things in the proper way to get the right charge, then what happens is the next day or a few days later, they get an email or a call from the billing office asking them a question on a patient. Now they've seen 40 other patients in between and have to try to remember. So one of the nice things that with this Fluency Direct is that while you're editing the note and completing the note, if it notices that a certain key piece of information is missing, like, for example, I'm a plastic surgeon, so if I remove a skin cancer from someone, if I forget to write what the diameter of that was, it'll prompt me to do that. So we call them computer-assisted physician documentation nudges. It gives you a little nudge, and that's automated. That's using AI. It's sort of continuously analyzing and monitoring the clinical documents to make sure that there's nothing incomplete, because that's a stress on physicians. And then that bill won't go out, and then there's some problem later, and by the time you're dealing with it, it's hard to remember all the details. That's also a really nice feature.
So basically, 3M Modal Fluency Direct, Fluency Line, since the support staff isn't coming back, this AI technology basically frees up the physician to better care for the patient without having to worry about things that they're going to remember. The AI does it for them, right?
Well, you're right. And now you mentioned 3M Modal Fluency Line, and I want to just take a moment to talk about this, because this is the next thing that's coming, and it's going to be launched soon, and we're very excited about this. So this takes it a step further. So the idea here is that in the exam room where you're speaking to a physician, there's a little device. We call it an ambient device. It looks kind of like an Amazon Echo, and it's in the room, and it's listening. And you walk in and you have a normal conversation with the patient. You listen to their complaints. You do a physical exam. As long as you verbalize what you're doing in the physical exam, like, so for example, I could say, okay, well, I'm listening to your heart. You have a normal, healthy rhythm, no murmurs. I'm feeling your neck. I don't feel any lymph nodes. As long as you're saying all that, which is good for the patient too, to hear what you're finding. The Fluency Line takes all that information and converts it into a electronic health record in the proper format, listing everything in the proper medical format with the medical terminology. It saves a tremendous amount of effort. This is different from the prior Fluency Direct, which is essentially just sort of writing what the physician says. But this takes it and puts it in a true clinical format, and it undergoes a robust quality review, and it's extremely cool. I mean, I recently went to 3M headquarters and tried this out myself, sort of with a actor pretending to be a patient, and it's amazing. So we're really excited about this, and so this takes out even the process of having to put something in the right format. You get your whether it's a history and physical exam, whether it's a post-operative check, whatever the format that you need, it comes up in that format. So it's very cool. So we're really excited about that.
Dr. Silverman, why are you on the radio talking about this now?
Well, there are major global forces in play that are transforming the world. things like climate change, resource scarcity, demographic shifts. Obviously, the digital revolution is certainly shaping the world around us, including massive advances in artificial intelligence. And so, at 3M, we believe that through the power of our ideas and science, of the smart people that we have, the scientists and engineers, we can navigate this shifting landscape and leverage our capabilities to help deliver solutions for these major societal challenges that are upon us.
Talk about the collaboration with Amazon Web Services, if you would, and then give us a website where we can learn more.
So, yes, what I just mentioned, this Fluency Line, we are working on this with Amazon Web Services. They have a lot of experience in this sort of technology, just as 3M has a tremendous, 40-year experience with, electronic health records, clinical documentation, coding, et cetera. So this collaboration, we believe, will bring the best possible product to the consumer, and we're extremely excited about this, really with the idea of improving that sacred moment when a patient and a doctor are in a closed room talking about, their most serious concerns. Bring it back to what it should be, as a doctor having time to listen and care for the patient and not worry about, checking off boxes on a sheet.
And a website where our listeners can learn more.
3M.com/HIS.
Ron, I appreciate your time this morning. Thank you so much for joining us. Hopefully you'll come back and tell us how the Fluency Line launch went. Thanks so much for your time.
Neil, it was a pleasure. Thank you very much for giving us this opportunity to speak to you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ron Silverman. Audio copies of this program are available at healthprofessionalradio.com.au. You can also find us at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.